Good afternoon, everyone, and welcome to this session of the Global Innovation Forum. This topic this afternoon is transforming healthcare, and I'm very delighted to be joined by two giants, really, of the healthcare business. First is Sean Carney, who's Chief Experience Officer at Philips, who are, of course, a real leader in healthcare. Topically, Sean's team have this week received the honour of being named Design Team of the Year in the prestigious Red Dot Awards. So he's just come back from Essen to receive that. So many congratulations, Sean, to you and the team on that. Those of us, working in design and innovation within healthcare will recognise the long-term commitment that Philips have had to be very progressive about design and innovation in that space. So well deserved, and I'm sure you've had a lot of fun celebrating that this week. And then joining Sean is Mathias Goyen, who's Chief Medical Officer for GE, covering the Europe, Middle East and Africa areas. GE, of course, also a very big player in professional medical systems, particularly imaging, diagnostics, patient monitoring, etc. Mathias is, in fact, has a clinical background, is a diagnostic radiologist by profession, but of course with a different role now within GE, and is, I know, has a keen interest in how technology, particularly AI, can help achieve better healthcare outcomes. We'll be talking about more of that soon. So welcome to you, Mathias. Lovely to have you here. We'll get off in the chat in a second. Just to let you know, we'll have Chris from Live Illustration capturing our chat as we go. It's always great to see Chris do his magic with the digital pens, seeing how we capture what we're sure will be an interesting discussion. So I thought, Mathias, I'd start with you and really ask, in your role as Chief Medical Officer at GE, what do you think are the most important areas or healthcare transformations that you're responsible for, and why are they so important to achieving better outcomes in today's healthcare environments around the world?
Yeah, thank you, Craig. Hello, everybody. For me, very high-level digital healthcare consists of a connected and highly accessible network, I would say, of virtual and in-person care with real-time and predictive insights supporting care collaboration across the entire patient journey. And I think it is AI-enabled workflow optimization that can and will help improve especially operational efficiency, so that healthcare professionals get to focus on what they do best. And what is this? Really providing patient care. And by enabling people to take better care of their health and well-being with personalized digital health solutions, we can promote a shift from sick care to true healthcare. And all these aspects together, Craig, that is how digital transformation can support better health outcomes, improve patient and staff experience, and ideally also lower the cost of care. And to your question, what am I responsible for? As you said, at GE Healthcare, I'm the Chief Medical Officer for the EMEA region. So I take care of the medical and clinical aspects of the business in Europe, the Middle East, and Africa. And being a radiologist myself, you mentioned it, I'm engaging in many conversations with our customers, ranging from like precision health, what is AI going to do with us? Is there a future for radiologists? And I'm really excited to be part of this panel today, and I'm very much looking forward to the discussion.
Great, thank you, Mathias. I'm sure we'll come back to some of those themes. Just turning to you, Sean, in your role heading up the experience design team at Philips, you fairly well clearly stated ambitions around transforming healthcare experiences for clinicians, patients, everyone, really. So what does that phrase transforming healthcare mean for you and Philips, and what are the current areas of focus for you and the team?
Yeah, I mean, if we look at the current situation in healthcare, it's obviously the whole healthcare system globally is under enormous pressure following the pandemic. And, there's financial issues, of course, because they faced a lot of challenges during the pandemic, unforeseen challenges there. But they have this huge backlog of elective surgical procedures that were delayed. Those are now starting to impact on the care providers today. And it's putting enormous pressure on the staff, both the clinical staff, but also the operations within the hospital as well in the healthcare systems. So you've got exhaustion setting in. Staff are exhausted, and there are too few of them as well. There just aren't enough people now to go around and meet the needs of the populations who are struggling. So what I'm trying to do, what we're trying to do right now, is really focus on pragmatic solutions that can address these immediate concerns, and whilst at the same time keeping an eye to the future so that we don't end up in this situation again when, God forbid, the next pandemic hits us or the next variant hits us. We really need to make sure that we're building back in a more scalable and sustainable way, so that we can maintain the right kind of quality of care going forwards. And as Mathias said, I think it's important that we frame that challenge, and we use the quadruple aim as a frame. So starting with the patient experience, but in order to deliver a good patient experience, it's very clear to us that, or to me, that you've got to enhance that staff experience. Now more than ever, they need the tools, the capabilities at their fingertips to deliver what the patient is looking for. And of course, what the patient's looking for is a better outcome. We're not creating a theme park here. We're not creating a leisure environment. We're creating a system that will help diagnose people as soon as possible, give them the necessary therapy in a personalized manner, and get them out of that system and back into leading a normal, healthy life as soon as possible. And we also have to do this whilst being extremely mindful to how we lower the cost of delivering that healthcare, so we can make it more accessible to more people, even in the most resource-constrained environments as well. And from a personal level, what we do, and what I do, and what my team does, is spend as much time as possible in the hospitals, shoulder to shoulder with those care providers, and the operations teams within these healthcare systems as well, using what we call in our design philosophy a process of radical empathy. So that means getting so close to the action that we often joke we wear black shirts, not because we're part of the priesthood of design, but because we don't want the blood splatters to show up on our shirts. But seriously, it really helps design meaningful solutions if you have a deep empathy for the real context with which care is being provided. So that's a real focus for us right now.
Yeah, I think the experiences of the pandemic probably, shone for all of us a much brighter light on the strains and pressures of healthcare professionals working within systems, in all countries really. So I guess it's easier for everyone to relate to that topic, Sean, of the deep empathy with those professionals. I guess you're doing that anyway. And Mathias, you mentioned a similar thing. So what are some great examples of, Mathias, you mentioned about how technology helps people do their jobs better. What are great examples of things that you've worked on or that you've seen that bring that to life? How technology and advancement can make life better for professionals working within healthcare?
Yeah, let's maybe go one step back and ask ourselves, where are AI and advanced analytics helping to deliver better patient outcomes? And I see three levels in the health system. The first level, I call it the individual level. That means we are embedding AI capabilities right into our scanners, our ultrasound devices, I come to that in a minute, our X-ray equipment, or into our PACS systems. And the second level where we apply AI is the departmental level. I mentioned it earlier, operational AI. We can use deep learning capabilities to streamline workflows in radiology departments or private imaging centers. And finally, there is the hospital or even network level where AI and predictive analytics can be used to better manage patient safety, patient experience, and patient volume in an entire hospital or even hospital system. And to make this more tangible, let me give you probably three really quick examples. So the built-in AI into a device, we have a mobile X-ray system with an on-device AI solution. And this is our critical care suite. And this app automatically analyzes images upon acquisition. For example, at point of care on the ICU at 3 o'clock in the morning when the red tech is doing the image. And and is searching for critical findings, for example, a collapsed lung, a pneumothorax that everyone fears, and then giving triage notifications that are sent directly into the PACS system without having to route images to like an edge server or cloud AI solution. So it's not about is the AI outperforming the radiologist, or is the radiologist still better? It's just a nice way of image prioritization, especially when there are only few radiologists on site, let's say on call in the middle of the night. And the second example I'd like to share is a mobile ultrasound device. We have developed a mobile ultrasound device that you can connect with your iPhone or Android a smartphone. And just imagine a pregnant woman, let's say, in a remote village in India, where there is probably no healthcare facility, no GP, there is basically nothing. So the midwife, who is hopefully probably there, that is taking care of that woman, can perform an ultrasound, and the built-in AI helps analyze and decide if, for example, the newly developed pain is part of a normal pregnancy, or if it's better to travel probably like 15, 18 hours to the next polyclinic. So AI really enables also access to care. And it's very interesting. We initially developed the device more like for rural India or sub-Saharan Africa. It turns out that also the HCPs in the developed world, they love the device. Like this is like the new stethoscope, you can rule out free fluid in the emergency room, etc. And a third example I'd like to share is our command center approach. When you think of really an entire hospital or hospital networks, clinical command centers are using AI and advanced analytics to coordinate patient care and resources across the entire health system. I mean, they streamline care delivery. They can find you an empty bed in the middle of the night instead of calling the ward, and the nurse on call would say, there is no bed available, and you never know if this is really the truth or if the bed is just reserved for an important patient coming the next morning. So you have full transparency of what is going on. You can direct resources to areas of high need, and you can give healthcare providers the critical information they really need to best care for their patients. And I think it's a beautiful marriage, I would say, between artificial and human intelligence coming together 24 hours a day, 7 days a week, to really detect risk and coordinate complex of care. And these were just 3 examples I wanted to share here.
Great, really interesting ones too. I think I hope everyone was keeping up with some of your technological descriptions and clinical descriptions, Matthias. Just about hanging on there, but it does really highlight a point, Sean, that around the use of technology. So that's clearly important in lots of ways, but there's a very individual expertise, personal element to this, and how I guess in a lot of your work you've got one eye very closely on the users and another on how the technology can support that. Any thoughts on that topic?
Yeah, a lot of what Mathias was talking about there, I fully recognize, and we've worked on similar solutions in those exact same spaces as well, of course. But I think it's important, and this is part of my role and my team's role, is to make sure that the technology is really serving the needs of both the patient and the care providers as well. And we can get too hung up in our own world of developing these algorithms and get excited by sheer volumes of data that become available to us from our radiology departments or our patient monitors and things like that. But in the end, it's maybe looking at how do we not replace any human intelligence, as Mathias quite rightly said, but how do we more augment it? And that's the way when we use the term AI, we're really talking about augmented intelligence now. So, if I go back a few years, we developed our first algorithm around the radiology suite. And we had this fantastic algorithm that would help the radiologist spot anomalies in the scan and highlight them and come with suggestions and all the rest of it. And we thought this was the best thing since sliced bread, English expression, sorry. And until we went and sat side by side in the radiology reading room with the radiologists and discovered they weren't using it. They were turning it off, in fact. because what we'd inadvertently done was create the equivalent of the Microsoft paperclip. That, if you remember that little guy, if you're old enough, that would pop up in the middle of your Word document and really bug the hell out of you. So they were turning it off because what it was doing was disrupting their normal thinking pattern, their analysis of that image. So what we then did was go back and then enhance that AI so that it really would augment their workflow and their way of working. So really personalizing that technology to enhance that radiologist in their context, in their reality. The other areas I think maybe just to touch on, I think making sure that you've kind of got this ability to oversee and provide that backup support, as Mathias quite rightly talked about. If you're in a busy ICU, for instance, middle of the night on a weekend, perhaps it's 3 o'clock in the morning, 4 o'clock in the morning, you've got all your beds full, alarms are going off as patients move, as monitors go off and things. Now, in amongst all that noise, you've got one patient who is deteriorating. Now, how do you spot them? You're tired, you're fatigued, things are going wrong, and it's so easy to overlook that patient. Well, what we've been able to do is kind of enhance the in-facility observation by looking at early warning algorithms that can predict when a patient is going to deteriorate and raise an alarm on an individual device for the nurses or the intensivists in that ICU. But going beyond that, what we've also been able to do is have that data shared. And a nice example is we've got an ICU in Atlanta, Georgia, which is sharing and monitoring beds with a similar unit in Sydney, Australia. So what you've got is a team in the daylight, in the middle of their day, who are bright and sharp and fully caffeinated, overseeing these alarms going off. And then if they spot an early detection or get an early warning flag, they can call the people on site at the bedside and supervise the intervention there. So it's not trying to replace the human. We're combining human oversight with augmented intelligence to create a really robust solution that will help save lives in that context.
Yeah, great examples. Just a question coming from the audience from Howda. I hope I'm pronouncing that correctly. Asking about how far away from having AI-based technologies as mainstream tools in healthcare, and what are the main barriers you foresee? I guess they're already here. They're from much of what you've talked about. They might be less science fiction looking, but much more practical in some of the things that you mentioned. So other examples of when we talked last time, some of those system wide AI tools that help to manage populations within hospitals, etc. An interesting topic for me really is as to how some of the more practical immediate applications of AI. Mathias, you were talking last time about that sort of topic.
Yeah, when I see that question, I think it's very important to say it is strategy and not technology that drives the digital transformation. So we are talking about a real change management process, a paradigm shift. I would say that you need the entire organization to buy into, like the clinicians, the IT department, the technical stuff. People must be really committed. You need, how to say, ambassadors or change agents within the organization who are not only ready to get used to the new environment, but actively promote it internally, right? And to Sean's point, I can tell you from a clinician's and radiologist perspective, all these efforts are only accepted if it doesn't get more complicated. It sounds arrogant, but if it's only one more click, radiologists will not use this, because if you're reporting CTs, you report 50 CTs a day. And the irony is that while this technology is initially designed, of course, to help productivity, it actually can add more work and complexity. So the best AI application is the one that is invisible, that is seamlessly integrated into the workflow, kind of unfolding its magic in the background, right? We have done everything right if the radiologist doesn't even know that AI is at work. They just realize that their work list is prioritized and that their tasks are completed more efficiently. So it's like an invisible friend helping you run faster. And by the way, the patients are the winner in this game, as AI will lead to a more precise and a faster time to treatment. That's my firm belief.
And both of you using examples there that really typically within healthcare professional establishments, hospitals, and other clinics, decentralized clinics, etc. Clearly, there is increased activity and interest in personal health and wellness through things like wearable devices, and so on. New features on Apple Watch, for example, all the time. Many startups within healthcare promoting new ideas. How do you see those sort of personal diagnostic therapeutic tools becoming better integrated within healthcare ecosystems and helping to drive positive health outcomes?
Yeah, I think the challenge right now is obviously everybody's got a keen interest in healthcare, and it's ripe for innovation. We know that, and there are a lot of startups, a lot of very excited people in there coming with new solutions. But we really need to think at the system level, because all of these great ideas in isolation need to fit into an integrated care pathway. And to do that in a highly regulated industry like healthcare, you really need to understand all those regulatory conditions and understand how to get your API to really interface with the next part of the process. So how do you share data? How do you pull data? And how do you store that in a HIPAA compliant manner so that it's anonymized and depersonalized, but at the same time can be recovered to facilitate more precision and personalized medicine as well? So it's complex, it's not easy. And I think the big companies like ourselves, GE, Siemens, etc., we have a role to play there in also facilitating access to startups and ventures to enable them to plug into this system in a safe and controlled manner that enhances the system rather than creates more complexity, to Mathias's point.
Good, yeah. I'll just maybe inject a question from even Evangela, who's asking, whether there are, taking that system thinking further, Sean, whether initiatives that integrate with and collaborate with local communities, governments, etc., to make that work at a system level.
You have to. I mean, again, we're working with a number of government authorities around the world and regional authorities to really look at how do you build back these resilient healthcare systems going forwards. And if you like, this has created a unique opportunity now to accelerate the adoption of digital healthcare systems. Everybody thought they were great ideas. Everybody was interested. We're having lots of great discussions 3 years ago, but there wasn't really a commitment to drive it. That has changed fundamentally now, 2 years after after the pandemic. So we're seeing now a huge appetite for looking at accelerating digital transformation in healthcare. Because they really cannot continue the way they are. They need help. They don't have enough people. The costs are going out of up through the roof. Not to mention all of the other challenges now with supply chain issues, runaway inflation, all of those kind of material shortages. There's lots of reasons why we really do need to drive innovation in a much more speedy manner now.
Good. And Mathias, I wonder whether you've seen, been able to observe changes that have been enforced or accelerated by the pandemic that you see that will stick going forward, either out of necessity or because, as Sean said, they've been forced to be tried and proven to be successful.
Right. I think the pandemic has clearly shown, or when I talked to CEOs in C-suite, they said that they have accomplished more in the last 18 to 24 months with regard to digitalization than they had planned to probably for the next 5 or 10 years. I think there is the momentum. People are embracing technology, critically embracing technology. And just to Sean's point, and you also mentioned personal health, right? I mean, there is a trend to move towards a more personalized healthcare approach, right? So that means we need to go from an environment where everyone receives the same care pathway, the same way of diagnosing and treating disease, where only some people have positive results, to a world where I would say people follow different care pathways tailored to their needs, increasing the proportion of people with positive results, right? I mean, there is traditional radiology data, which is in vivo data coming from the machines. And there is omics data, which is, pathology data, lab data, EMR, but also you mentioned the wearables and fitness trackers. And quite frankly, fitness trackers were developed as an option for athletes. And now we have to turn them into a medical device, right? I mean, those who have one, and I want to say something nice, don't need one as they are athletic anyway, So it's great to have additional data points, but big data doesn't necessarily mean big insights. I mean, we have to play it smart. And this is what Philips and GE is at the forefront, quite frankly, together with our partners. You mentioned partnerships, if I may. There are smart people in Philips, there are smart people in GE Healthcare, but if you do the math, the majority of smart people globally are outside Philips and outside GE Healthcare. So that is why partnerships are so important, because it's only the clinicians who really know where the pain points are. Sometimes we develop something, our engineers develop something, not having the clinical expertise, and we simply need our customers to tell us if that what we think is great really solves the clinical pain point.
Yeah,
good thoughts.
Fully
Yeah,
agree,
great point.
Yeah, I
Sorry,
was just going to build on that. I mean, I fully agree that as a designer myself, I know I can't do this alone. I need the technologists. But I saw a question coming up or a request there. I think the key thing is, exactly as Mathias was saying, is get the people who have the problems to team up with the people who can solve the problems. So we've got amazing physicists and biologists and radiologists within the company. And then you've got all this huge population of healthcare workers who are struggling with these day-to-day challenges. So break down the barriers. Again, this is where my practice of radical empathy comes in. Get the people who can solve the problems shoulder to shoulder with the people who have the problems, and then you can drive really meaningful and impactful innovations that will really change the way healthcare is delivered. And I think challenging the status quo is key as well. Often I'm fortunate in Philips that I get to design everything from the smallest device that goes in a catheter inside your heart all the way through to an entire hospital. And we get these requests for, we need a new hospital, we need a new cardiology center. And the first thing I do is challenge them. Well, what does the patient need? I know what you need from a business context, but what does the patient need? What is the population that you're servicing? What are their needs? And how do we best deliver care? Is it really through this shiny new monolithic hospital? Or should we look at a distributed care model where we bring diagnostics, for instance, closer to where they live and avoid long journeys and even therapies closer to where they live, so families are not having to travel out of state, for instance, to get the care they need.
Yeah, so no one size fits all solution. So just to quickly finish off, and this is, goes completely against that, but I'll ask it anyway. I was keen just to sort of finish off by asking that if we were sat here, the three of us, in 5 years' time, what transformative changes in healthcare would have happened, and would we all most notice, and what would have made the most impact? Not an easy one to answer quickly, but yeah, let's have a go.
Greg, I think moving forward, that digital solutions powered by AI will become even more important, because they're revealing their great benefits. What are these benefits? Greater productivity, faster availability, less administrative work. And what the pandemic has shown, it makes sense. You have a spatial separation of physician and patient. So we are really undergoing a paradigm shift from why digital to like asking ourselves, why still analog, and Sean mentioned it, our customers ask us how we can make their machines more productive and how they can interface with patients using innovative technology. At one level, it's clear that the technology must be simple. Patients and doctors need technology to be intuitive, I would say. On the other hand, building digital health systems requires a complete modernization of the current infrastructure to enable virtual hospitals, smart hospitals, you name it, or to enable greater access to care and ultimately lower the cost of care. And just to finish up, COVID-19, I think, has shown that we can quickly come together as an entire industry with our customers to accelerate this innovation, making digital solutions and AI not something to fear, but rather a helping tool to enhance the work of healthcare professionals.
Okay, it's very
Maybe
optimistic
just
views.
to quickly sum that up, I think, yeah, completely agree. I think in the end, you'll see a shift from hospital-centric care delivery into virtualized care delivery systems. So you've maybe got the hospital's future is around more specialist care, the more advanced care, but then the more regular care, so imaging, diagnostics, and things like that will be distributed on a wider network, but all connected real-time by this neural network of digital data flowing seamlessly between all of these locations, allowing that individualized and personalized care to be delivered across multiple locations in real time.
Great. Okay. Well, I think we are probably out of time at this. Good notes to finish on. Lots to be, I think, excited and optimistic about, but equally lots of challenges within healthcare, which is, I guess we would all agree why transformation and innovation is needed. But it's a subtle and complex way of how to apply that in a way that's going to be most effective. So, great discussion, Sean and Matthias. Lovely to talk to you. Lots more coming up for this afternoon session, Global Innovation Forum. Enjoy the rest of your afternoon.
Thank you.
Thank you.
Thank you.